Knock, knock, knock. May I come in?
Yes.
Hey, my name is Gabby. I'm your student nurse today.
Hey, Gabby.
Hand hygiene. Can you tell me your name and date of birth for me, please?
My name's Justin Davis. January 20th, 2000.
Good job. Thank you. I'm going to ask you a few questions and do an assessment on you. Can you tell me who the president is?
Donald Trump.
Good. Do you know what year it is?
2020.
Okay. And do you know where you are?
The hospital.
Good. Are you able to swallow for me? Okay. Now I'm going to check to see if your pupils are equal, round, and reactive to light and accommodation. So I'm going to check if you can look straight at my nose. Yes, they are equal on both sides. Keep looking at the nose. Okay. They are reactive to light. Now if you can follow my pen.
Ooh.
And they accommodate. He's able to speak correctly. How a patient responds to stimuli. He's responded verbally. Now I'm going to use my pen and I'm going to touch different places on your face with your eyes closed, and you let me know if the sensation is dull or painful.
Okay, I'll close my eyes for you. That was sharp. That was dull. That's dull. That one's sharp.
Good. You may open your eyes. So now I'm going to auscultate your breath sounds.
Cool.
Take a deep breath for me. And listen to the back of your lungs. And I would check the other side as well. And of course you want to listen for them to have a full breath for each location that you go to. And he had clear breath sounds, and he is not using any accessory muscles, nasal flaring. Do you have a cough?
No, ma'am.
He does not have a cough. So now I'm going to check his blood pressure. Use your left arm if that's okay.
Sure, I'll take my watch off for you.
You don't have to take your watch.
It's okay, I will take it off for you. You want me to hold this straight for you?
That's fine.
Help you out a little bit.
Thanks. One 110/68, which is good. And a normal blood pressure. So now I'm going to check your apical pulse, which is the left midclavicular line, fifth intercostal down. Can you lift your shirt up for me, please? And that is a regular rate. I'm also going to check your capillary refills. If you can give me your finger, and I'll hold for 5 seconds and release. And he has less than 5 second refill. Now I'm going to check your peripheral pulses. You can check the carotid. Actually, I'm going to check the temporal first, sorry. And then you check the opposite side to compare. Then the carotid, then the opposite side to compare. Brachial, opposite side to compare. Radial, opposite side. Femoral, inside of the groin, opposite side. Popliteal, underneath the knee, opposite side. Dorsalis pedis, on top of the foot, opposite side to compare. Then posterior tibialis, right above the ankle, and then the opposite side to compare. Also, while listening or checking his radial pulse, I will check his respiratory rate, so that way he does not know that I was monitoring his respiratory rate. Good. You have a good respiratory rate. So now I'm gonna listen to your bowel sounds. You can lift your shirt up for me again. Listen to all 4 quadrants for 5 minutes to hear if you hear bowel sounds.
Oh, I'm sorry.
And I do hear active bowel movement sounds. And then abdominal assessment. So what you do is go to each quadrant and in a circular motion palpate for pain. If at any time you feel pain, let me know. And I don't feel any abnormalities or anything like that, and he did not feel pain. Then I would ask, do you have an indwelling catheter?
No, I don't believe so.
Okay. If you want, you can put your shirt back down for now.
Thank you.
How often do you urinate?
Usually urinate a lot,
Okay.
especially when I drink caffeine.
What color is your urine?
It's good yellow.
Is it clear or cloudy?
It's clear, good
Okay.
yellow.
When was your last bowel movement?
Yesterday,
Okay. What color did it look like?
it was brown.
Was it formed or would it look soft?
It was formed. It was also soft looking.
Okay. Have you noticed any urethral discharge?
No, not recently.
Are you incontinent and need to use a brief at any time?
Nope, I can go.
Okay. Is your diet restricted? Do you have any underlying diseases where you need a special diet, or are you on a regular diet?
No, ma'am.
Okay. If you had a plate and the plate was 100%, about how much food percentage-wise do you eat each meal?
I'd eat 100 on a big
Okay.
boy.
Do you tolerate the food well?
Yes, ma'am.
Okay. Now we're going to assess your hand strength. So if
Okay.
you can squeeze my fingers for me. Job. And then the other side. Good job. Now we're going to do ankle strength. I'm going to push against your foot, and if you could push back. Good. Good. Any edema or swelling that you noticed on your body?
No, ma'am.
So then I would check his lower extremities and compare it to the other one to make sure there's no edema noticed and there's no swelling or edema or pitting edema, and no discoloration to his extremities. Sorry. General condition of skin. So noticing his stomach when his shirt was up, his skin was normal. I didn't see any wounds or anything like that. I guess if you lean forward, I'll look at your back. If you can. You want me to put the seat down?
Yes, please. The bed. You want me to take my shirt off?
You can just lift it up.
Alright.
Okay. And nothing on his back. He does have a few moles. Have you noticed any changes to these moles?
No, ma'am.
Okay.
Not recently.
No wounds or any open or any skin being discolored. Skin is warm and dry. It is appropriate for his race. I'm going to check your skin turgor if you can. I'm going to pinch near your collarbone.
Okay.
And it goes back. So, skin intact and good turgor. No wounds, rashes, or red areas. I'm going to check his scalp, but I would make sure that I actually had gloves on for that. His scalp is clear. No pediculosis. And no lesions or wounds or discoloration to his scalp. Then I'm going to ask him, do you have any pain?
I do.
You do, okay. Out of 1 to 10, what is your level of pain, with 10 being your worst amount of pain you've ever felt?
It's a good 2.
Okay. When did your pain start?
A couple months ago,
Okay. Where is your pain located?
on my finger, I
How long has pain been present there?
For the whole 2 months.
Okay. Is the pain on your finger, is it sharp, dull, throbbing?
I'd say it's sharp when I hit it.
Okay.
Otherwise, I don't feel it.
Does it hurt if you move your finger at all, or anything that alleviates it?
Just when I hit it, just not hitting it on things alleviates it.
Okay. Does your pain radiate anywhere else onto your finger, your hand, or anything like that?
No, ma'am.
Okay. And how often does your pain occur? Or does it occur constantly, or does it intermittently?
Just whenever I hit my finger, that's...
All right. Thank you.
You're welcome. Thank you, Nurse Gabby.